of gender. Hi, everyone. I'm Ivy Hill. I'm the Director of Gender Justice with the Campaign for Southern Equality. Together with our partners nationwide, we lead the Trans Youth Emergency Project, which helps families of transgender youth navigate access to gender-affirming healthcare. So today we're gathered with advocates, parents, and supporters across North Carolina to share information about recent changes in North Carolina that could impact access to gender-affirming care for trans young people. So thank you so much to our partners at Equality NC, Charlotte Trans Health, and Youth Outright for partnering with us on this town hall, and just for all the incredible work that y'all do day in and day out. You make such a huge impact in North Carolina. We know that the landscape for trans youth healthcare access has been shifting in real time for the last 3 years or so. That's when we launched the Trans Youth Emergency Project. It's really aimed at helping families of transgender young people navigate restrictions or outright bans on their health care. The care that is recommended and deemed necessary by every single leading healthcare organization. We provide information and funding to families to help them continue their care and to imagine all of their options. 27 states, including North Carolina, have passed bans in the last 3 years. And since the Trump administration began about a year ago, the attacks have shifted to also include attacks from the federal government. Our ethos is that when the government moves to restrict access to gender affirming care for transgender young people, we move to support families, helping them identify safe pathways to care, and then providing them resources they need to walk that path. There have been a few different developments in North Carolina over the past few months, including closures at UNC Health and Advocate Health. Before we break down what's happening, I want to do a quick agenda for our call this evening. So first we'll have Kenny Cummings, who runs our parent support group, share some of our taking care resources. Next, we'll talk a little bit about the recent clinic closures at UNC Health and Advocate Health. After that, we'll hear from team members from our Trans Youth Emergency Project, and they'll share information on what tangible resources are available to families right now. Then we'll hear some action steps that families and allies can take right now, and we'll hear from our partners at Equality NC, Charlotte Trans Health, and Youth Outright. And then we'll wrap up with some time for Q&A. So with that, I would love to throw the ball over to my friend Kenny, who will share some care resources.
Hi, y'all. My name is Kenny, and I use they, them pronouns. I have the immense joy of helping to run a parents group. And I want to talk to you just a couple minutes about what care resources that CSE is providing currently. It's always important that we create these spaces of care for ourselves, and CSE has a whole healing and resiliency program here to support you with those. So here are the offerings. We have an incredible transparent support group that's nationwide that folks can join on once a month. So our next one is on April 19th, and you can register online, and we'll make sure you get the Zoom link to be in space with other parents who are dealing with the joys, the highs, and the lows, and sorting through that. It's a space that's intentionally crafted for parents, and we make sure that other folks are not in that space so that people can have real and raw conversations. We also have an incredible virtual wellness kit that just helps you keep your head and your heart held high. Lots of resources that folks can enjoy. And it's always standing on our website. And then the last, but certainly not least, is our Trans Cookout podcast. We have several episodes that these are interviews with trans leaders across the country, and we always end each of those podcasts with a message to young people, particularly trans young people, that's always uplifting and affirming. And so it's definitely a resource for adults, care practitioners, and trans youth themselves. I just want to remind folks that all these resources, especially our support group, are available nationwide. You can always access them on our website. And I also want to thank and encourage all the parents and caregivers You guys are creating safe home environments for young people. You're continuing to encourage them to create homes within themselves and their supportive communities. And that's something that no government or policy can take away from us. I'm going to go ahead and hand it back to Ivy, where they're going to share more about the current landscape here in North Carolina.
Yay, y'all. Thank you so much, Kenny. I think the work that Kenny does is just so important and really speaks to that. It is important to be able to find access to care, and also we are whole people and whole human beings, and this is just a different approach to care that I feel is really so important that we include all that in our work. So thank you so much, Kenny. This part's going to be heavy, so just take a breath. It's okay. We're going to get through it together. You don't have to do it alone. But I do want to just do some level setting about where we are in North Carolina with regards to gender affirming care. So first, I want to talk about some 2023 legislation. In 2023, North Carolina passed HB 808, which bans best practice health care for transgender youth, making hormone therapy, puberty delaying medication, and surgery inaccessible in North Carolina for any trans person until they turn 18. The law states that youth who were in a course of treatment prior to August of 2023 can legally continue to access care. But this has already been disruptive to trans youth in our state, especially young people who aged into care between 2023 and now. But it's not just state attacks that we're looking at. We also have federal attacks that impact access to gender affirming care as well. The first of those that we'll talk about is the HHS declaration. The Department of HHS on December 18th released an unprecedented declaration that seeks to reject established medical standards of care for transgender young people by administrative fiat. HHS has attempted to use that declaration by threatening several children's hospitals with total exclusion from Medicare and Medicaid for providing medically necessary care to transgender young people. In response, more than 20 state attorneys general filed a lawsuit a few days later, and they have been able to slow down the case. HHS has now agreed to stop enforcing the declaration while the lawsuit proceeds. This declaration is not in effect right now. It is tied up in court, and what happens there remains to be seen, but stay tuned as we're definitely watching that. Um, the next thing is Centers for Medicaid and Medicare Services proposed rules. So, on top of that declaration, CMS issued two proposed rules. The first says that patients insured by Medicaid, Medicare, and CHIP cannot use those federal insurance plans to cover gender affirming care for young people. The second says that hospitals that participate in Medicaid and Medicare, that is, accept Medicaid and Medicare insurance, are not permitted to provide gender affirming care for transgender youth. There is an important note about this, though, which is that these are proposed rules. There was a long public comment period, and now the government is reviewing those comments. There may be changes to the proposed rules before they go into effect, and we don't have an effective date for those yet either. I think it's also really important to note that the ACLU has said they'll file a lawsuit once there is a final rule, and that could delay things further. So these things are bad. This is absolutely true that these things are bad, but they are also not in effect right now. Um, so another big thing that I wanted to talk about, though, were some recent closures that we've seen at UNC Health and Advocate Health. So in late January, UNC Health and Advocate Health announced that they would no longer be offering gender-affirming care for youth under 19. This decision was made in response to federal attacks and has impacted youth who were still able to access gender-affirming care in North Carolina despite the ban due to that legacy clause, and 18-year-olds who were not covered by the North Carolina state ban. Dozens of clinics and hospitals across the country have ended gender-affirming care for youth under 19 in the past year. So if they don't have to do that, why are they doing that? We call this overcompliance and pre-compliance, where you're not actually legally required to take action, but you're choosing to do so anyway. With the federal attacks and possible state attacks, they are essentially suspending care outright. So I know that's a lot, and it is a difficult time and a really confusing time with everything moving and changing so quickly too. But I promise you, you do not have to do it alone. And this program that we're going to tell you about actually brings me a lot of hope and joy. And I'm excited to turn things over to my friend Desi, who is our incredible program director of the Trans Youth Emergency Project, to tell you a little bit more about why there's still hope.
Hey everyone, my name is Desi Hall, and my pronouns are she, her, hers. And I'm so happy to be here with y'all and to introduce myself. I am a child of the South of Alabama specifically, but I am based in Atlanta and am so excited to do this work and to bring a lens of Southern resistance and wellness and all of the things that are so important to me. And I want to begin by thanking the parents, caregivers, and young people on this call. I want you to know that you are not alone and that your questions, fears, and hopes matter here. At Tie Up, our work is about removing barriers to care and helping families find their footing when the path forward feels unclear. This town hall is a space to name what is happening, share what we know, and remind everyone that support is still here. We're here to remind you that despite the things you may hear or read, that there is a pathway to care. Our work also focuses on building partnerships with organizations and advocates who are supporting families on the ground, especially during moments like this. So thank you to all of our partners for being here. You are the trusted experts in your local community, and we hope that you can connect with people in your networks and connect them to these resources. I want to thank you by beginning to thank you for the critical works you're doing in your community, whether you're helping families navigate care, sharing trusted information, or simply showing up with compassion. Your work is making a real difference, and families are looking for clarity and hope, and you are helping provide both. As we move forward, I warmly invite you to connect with us, to share resources, explore partnerships, and think together about how we can best support families in this moment. At the for Southern Equality, we're committed to supporting families and those who support them by breaking down barriers to accessing care through efforts like the Trans Youth Emergency Project. We're working to help families find unimpacted providers and feel less alone as they navigate what's ahead. The top line of what we do is if your family loses access to your care provider for whatever reason, we are here to help. And what exactly tie-up is, we provide a few different things. So we provide navigation services, which means if you lose care for whatever reason, that could be the clinic that you were going to shut down, or a new ban was enacted in your state. We are here to help you find those options. And for families who are already in these banned states who just need to start care, we are also there available to help folks identify places to start care. And in that, some families identify that they have to travel in order to receive care. And for those families who are living in banned states where care is illegal, we provide $500 travel grants every 3 months for these families to get to their appointments. And for families who live in access states where care is still legal, but they need to relocate their care due to a specific closure, we also provide a one-time $500 grant. And we also just stay here as a place for folks to return back to when they have questions or are scared about future interruptions or hearing things and just need some clarity about what the future of care could look like for them. And beyond that, we are also connected to a wonderful organization, Elevated Access, that also provides flights for families who need to travel even longer distances. And these flights are sometimes commercial flights, but other times they're volunteer flight pilots who are giving their time and resources to support families in getting to the care that they need. Um, we really offer a lot of wraparound support, a lot of what you heard about earlier being that parent family support group, the supportive schools program, which is another program we offer. All of that is offered through our navigation services. And in that first navigation call that families have, they will figure out what resources you need. And if it's all of them, we're going to make sure that you get connected to all of them. Um, but I want to hand it off to one of our wonderful navigators, Sherry, to talk a little bit more about what the tie-up process looks like, so you know what to expect as um, as you begin getting through our process from navigation. Sherry.
Thanks, Ezzy. Yeah, um, so what you're going to do first is you're going to head to our website and you're going to fill out the form. I think Adam is probably dropping that link in the chat. And we'll be in touch as soon as possible, usually 3 business days, sometimes longer if we get a big surge of requests. We schedule a one-on-one call with the parent or guardian, and then we talk through the options and your unique situation. So those options include what clinics are available, what clinics are, in proximity to where you are or elsewhere. We'll explain elevated access, which Desi just mentioned, about free flights in, getting to your appointment. We will talk about the travel grant and get you signed up for that, as well as other resources. We'll also talk about Planned Parenthood. I'm sorry, not Planned. PFLAG and other local orgs and state partners who might be able to help with any other issues that come up, including insurance issues, legal matters. We know that parents always have a lot of different questions about everything under the sun, and we do our best to know what's happening and find those resources so that we can get them to you. The grants are processed electronically, so through Venmo and PayPal mostly. We can also do checks if needed. If you live in North Carolina, we will be in touch every 3 months, just to check on whether another grant is helpful. So families in states with a statewide ban, like North Carolina, can receive up to 4 grants of $500 each per year. And I imagine most folks watching this and in here are in North Carolina, but in case there's folks from other states, for families who live in states where there is not a statewide ban and they need to relocate care, we do a one-time relocation of care grant for $500, um, which looks a little bit different, but it's to help with any of the recent closures that have been happening. When it comes to those, we'll help you identify another provider in your state or nearby, and we can provide a $500 one-time relocation of care travel grant. And if that provider ever closes at a later date, we're here to help you find another one. We also host, so Kenny hosts, and Desi talked about it. We host a monthly support group for parents and caregivers of trans youth that's specifically targeted at families who are accessing gender-affirming care for their child. Our March session just happened this weekend, but if you go to our website or stay tuned on our social media to learn about upcoming support group dates, you can register. So, what can you do? So, action steps for families. I think, is it the next slide? Or are we still on the same slide? Yes. Okay. The most important thing you can do right now is to talk to your provider. Ask if they are impacted by anti-trans restrictions. If they're not, we recommend taking things one day at a time. I know this is unsettling, but one foot in front of the other here is the name of the game. A lot can happen. Lawsuits could push back timing considerably. The proposed rules could be modified. We just need to, unfortunately, take things one day at a time and one appointment at a time. And I know that's hard. You can write into the Trans Youth Emergency Project to better understand backup plans in case something happens to your current provider. We're happy to hop on a call with you and talk through any of those pieces, especially if you already have a provider and are feeling nervous. And we do our best to stay in contact with providers to sort of know, what's happening in that landscape. If you are impacted and your provider ever cancels your appointment, contact Tie Up for support. We can share providers who aren't impacted by the restrictions. We can answer questions and we can move funding to you to help pay for the cost of initiating new care and travel. So we'd love to hear from you. And now I'm going to hand it over to Ivy to talk a little bit more about action steps for allies.
Thank you so much, Sherry, and thank you, Desi, for sharing that information and for all of the amazing work that y'all do with Tie Up. So there are a few ways that everyone can take action directly on these attacks to support trans youth. One is to thank and support providers. I think it's really sad when folks are pre-complying and over-complying. It's really frustrating. It has a terrible impact on our community's ability to access care. And everyone should be pushing back against that, but not everyone is. And the truth is, it really takes guts and being willing to step up to the plate and stand up for what you believe in. And we do have providers who are doing that. So when they are, make sure that you take the time to support them. Also, they're a huge part of our ecosystem of care. Um, Also, find a local action or support group to attend and to support your local community leaders, which we're going to hear from some of those here shortly too, which I'm really excited about. You could host a fundraiser for Tie Up. The reality is that it takes gas in the tank to keep the program running, and a ton of those funds that we get in, we're just turning around and sending right back out the door to support families of trans youth to help them be able to actually access this care. So any support is always greatly appreciated. And the last thing I'll say about what you can do right now is just get involved locally, support local community, ask what you can do to help, and also stay connected. I know we don't often talk about this work around a framework of suicide prevention, but I think staying connected to community really truly is. So protect yourself and your community and get out there and get involved. And now I would love to pass things off to some amazing local partners who you can get involved with. And I think you're going to tell us about some events that they have coming up too and ways that you can do that. They are all doing terrific work for transgender youth and their families. We know that there is so much support that trans youth have, and there are so many resources, including amazing youth groups, medical providers, policy experts who are working to organize and advocate for LGBTQ people. So I hope you take some solace in knowing you are absolutely not alone. And I'm going to stop rambling now. I'm excited to throw the ball over to Alana with Equality North Carolina to tell us more about the incredible work that y'all are doing.
Yes, thanks so much for having us. So, my name is Alana Webb Newton, she, they pronouns. I work as the organizing manager for Equality NC. So, Equality North Carolina, if you don't know, is the oldest statewide organization in the country dedicated to securing rights and protections for all LGBTQ folks. We do this by advocating at every level of government and in the community to protect and uplift trans, queer, and BIPOC communities in North Carolina. So, what we do, we connect people to life saving resources, especially through our great partners, whether that's through gender affirming care or legal name change support. So, anything we can do to help you and get you to the right resources. And we also change hearts to sharing. We change hearts by sharing real stories. A big part of what we do is policy work. So sharing real stories is so important because policy changes must reflect real people's life experiences. And to help you tell your stories, to help you share how a bill like HB 808 is affecting your life. We do storyteller training so that folks are being able to craft their stories in the right way. So something that we're doing in a few weeks is a storyteller training 101 workshop, and that's going to be April 2nd. And you can find more information on our website about that. And the other part that we do is we educate folks in our communities to keep them informed, whether that's through bad bills happening in the legislature or you see something and or you want to be a good ally and you want guidance on how to do that. So we provide trainings for free about that as well. So that's really what we do. And in the next slide, I have some resources. So as Ivy said, we UNC Health and Atrium slash Advocate Health decided to end gender affirming care without warning, both instances, and Equality NC and partners quickly released statements and also created toolkits and resource pages for you all to go to so that not only are you pivoting and finding new ways to access care, but also calling them out on what they did because it's unacceptable. Over compliance or pre compliance is not what they should be doing. It is illegal. And as we know, gender affirming care saves lives and allows all trans youth and all trans people of all ages to thrive. So we want to make sure that we are getting access to some other resources that you can take up for now, but we also want to make sure that we're calling them out on all of the things that they have already done. And with the help of Charlotte Trans Health, we created a Atrium slash Advocate Health toolkit that you can access once we send these slides out. But yeah, I'll pass it to, I think it's Youth Outright.
Thank you so much, y'all. My name is Beck Martens. I am one of the co-executive directors at Youth Outright. And Youth Outright WNC is a space that is supporting queer and trans youth to live their truth. We support youth ages 11 through 24 across all 18 counties in Western North Carolina. Our mission is to create a world where all queer and trans youth are supported to realize their power and autonomy through self-determination. We help young people resist oppression by building community, healing, and growing together. Youth Outright engages in intersectional and intergenerational dialogue with a focus on gender justice, racial justice, and disability justice. Our work includes programming, training for youth serving organizations, and advocacy for policies that protect queer and trans youth. We have a youth center based in Asheville where youth ages 11 to 24 can access a comfy hangout spot, an arts and crafts room, video games, music, snacks, and a free store that provides gender affirming garments, safer sex supplies, harm reduction supplies, and hygiene supplies, and also programming 3 to 5 times a week. We have drop-in twice a week and educational programming every week for middle and high school age youth that focuses on queer joy, art, nature, mental health, harm reduction, and social justice. These programs include our weekly Wednesdays, Constellations, which is a queer and trans BIPOC youth autonomous space, and monthly new adult programs that are for young adults ages 18 to 24. We also support our local and regional GSAs through technical assistance, in-person and virtual visits by delivering programs. And also, we've seen a large reduction of GSAs in our area, in North Carolina as a whole, and also in Western North Carolina specifically. So Youth Outright is really trying to focus on our more rural counties in Western North Carolina. And so we're launching rural chapters of Youth Outright in the form of community GSAs. The first one that has started is the Transylvania County chapter, and we'll be meeting this Thursday. We have fabulous annual events, including Queer Juneteenth, the All Ages Stonewall Family Picnic, Rooted in Solidarity Summer Camp, and then Queer Prom, which is coming up super soon on May 23rd for youth ages 14 to 20. We also support queer and trans youth ages 24 and under who are in need of financial support through our direct youth payment program, and we provide young people with $200 stipends to meet their basic needs. We strive to be youth-led and are steered by our youth advisory board, which directs our programming. Youth themselves lead programming and the workshops in our spaces, and we strive to keep our youth at the center as our leaders. If you'd like more information, please visit our website, youthoutright.org, or email us at info@youthoutright.org. And that's all for me. Thank you. I'm going to pass it to Charlotte Trans Health.
Thank you, Beck, and thank you, everyone, for all the great information. So, I am Holly Savoy. I am the Executive Director for Charlotte Trans Health, and our mission is to advance health equity for trans and gender diverse individuals through education, advocacy, and accessible affirming care. So we are a multidisciplinary collective of healthcare professionals who are serving clients primarily in the Charlotte area, but we actually have providers who are actually spread throughout the state. And our education is focused on educating providers in affirming care. And we also do community education out as well in trying to dispel all the misinformation that is out there. Um, our advocacy is focused obviously in healthcare, and we try to use our privilege as providers to speak out against these attacks on trans healthcare and do other advocacy initiatives, including participating in partnerships like this and also ensuring that we stay abreast of what is happening so that we can best inform our clients and folks that are coming to see our providers. So we also offer a PATH program, our Providing Access to Trans Healthcare, which is a program for individuals who are 16 and older who are and underinsured. And we provide a variety of free services, including case management, therapy, pharmacy assistance, and linkage to medical and other resources. We also offer a therapist-led support group twice a month for individuals who are 18 and older. It meets in person in Charlotte, and our next meeting of that is actually tomorrow. So I can share information about that in the chat. And also, in terms of creating that access, we have a directory of providers who are affiliated with Charlotte Trans Health on our website. And our providers are spread across serving individuals of all ages. And we have many local providers, including in our medical providers, who are still following North Carolina law, who are seeing individuals who are 18 and older. And so there are a lot of resources that do still exist that are local, and some of them are also able to do coordinated care for youth, meaning that if someone is having to travel out of state and maybe use the tie-up funds for accessing care, they can still do coordinated care by also working with a local provider to receive some in-person care on a regular basis, get lab work done, and reduce some of the travel to a prescribing provider. And finally, wanted to mention our Trans Day of Visibility event. The Trans Day of Visibility is coming up on March 31st, but in partnership with Equality NC and some other organizations in the Charlotte area, we have our Kaleidoscope Mini Market happening this Sunday during the day, and it is open to folks of all ages, and it's free. And something that I know we all need right now is joy and just feeling that sense of community and connection. And one of those ways to experience that is to come out to events like this. There'll be a lot of fun and entertainment and resources. So if you are in the Charlotte area or want to come to Charlotte for the day, be posting information about that as well. So now I think that's time for Q&A.
Almost. Yeah. Thank you so much, Holly. Alana, Beck, thank y'all for all of the incredible work that y'all do. And it takes gas in the tank to run those programs too, if you're able to throw any support their way, uplift the work that they're doing on social media, all of that stuff is super important. And we appreciate y'all so much. Um, Families who are on the call, I hope that you hear and see that you have a great big community around you who loves you and supports you, and there are a lot of programs also to offer support to your family, and you do not have to do this alone. Um, Many families ask our navigators when they're on calls with them if they are taking resources away from other families by receiving a grant. And I just want to reiterate that you are not taking resources from another family by receiving support yourself. That is what this program is here to do, and we are here to provide support to every family that is impacted by this who has a trans young person and is reaching out for help. So at this time, we are going to go ahead and take some questions and try to provide answers from our community partners. Um, We will also have time at the end if anyone wants to share additional community resources that we haven't already shared, or also feel free to drop them in the chat at any time. I know there's so many more resources than just those that are offered by the folks who are helping to facilitate this call this evening. And it takes all of us. It's going to take every single strategy to provide the support that our community needs. So with that, we will go ahead and stop recording and jump into Q&A.